What we've shown you up till now are people who arguably in very good shape anyway. And this person is too. And this person might have what we call a body mass index, which is calculated by your height and your weight. This might be somewhere in the 20, 22 range. And this person is generally speaking very healthy. But they didn't like their stomach, and they didn't like their abdomen. So they came in, especially the lower abdomen, below the belly button.
And because of that, is this person considered overweight, or are they normal?
No, I think they're very normal. I think this is a normal body habit. It's just they just don't like their appearance. And you can see where accumulation of fat in this area would affect the clothing, specifically the pant size. And so you might have a situation where you're gradually gaining weight, and you can't fit in the clothes you used to. And so that's a big motivating factor. You really can't fool yourself when you get up in the morning and you can't fit in the same jeans. You know that there's something you need to change.
All right. So here we are addressing people that are in that normal range with their BMI, 18 to 25. Does the research show that it's helping people who are overweight, if not obese?
Those are not the best candidates. For one part, you probably have a hard time physically getting the machine to adhere to those areas. So if you have people who's very obese to the point where they're bulging, and we've all seen this before, and it's difficult to fit in clothing and things like that, the machine is definitely not going to attach. So physically, from that standpoint, it probably wouldn't work.
Okay, even for people that are not over that 35 BMI, which is that magic number to consider bariatric surgery, they're in that range. Let's say they are athletic. They try to keep themselves in shape. They try to keep the body firm, but they're still bigger people.
Right. Yeah, those really have to take it on a case-by-case basis.
Okay.
So the way I try to explain it is if you've got a fat layer, it's a given layer of thickness. Let's say you have someone who's small and that layer is thin, and someone who's bigger and that layer is very thick. If you take a quarter of that, does it really make a difference if the layer is that thick? Probably not. It's in a thinner person, if you're taking a quarter of what's there, it actually is going to make a more visible difference to that person. So you really have to take that into account of what you're removing of 25% of 100, let's say, just to be, and 100 is quite a bit. In one of these cases, it's not going to really make much of a difference.
So can the patient, when they're coming in for the consult, can you tell them how much body fat is underneath that skin and what could be addressed?
Yeah, we can tell by putting our hands on them, and that's what we do with every patient. We have them get into a robe, we take a look, we'll see, and we'll know just through experience and through utilizing the different hand pieces on this machine what's going to fit and what's not going to fit.
And what is body fat and what isn't?
And what is body fat and what isn't. What's really tricky is people who are thin and who really, and this is borderline kind of obsessive, but people who really want to eliminate that last little bit. And if you pinch and all you're pinching is skin, they're not a good candidate. So we've had to send people away because they're too thin, believe it or not.
All right. So what can be done for them?
Well, for them, it's not much. If they're really bothered by the skin, there's skin tightening procedures are being developed, and those usually involve more heat than cold because what you're trying to do is contract. And there are some devices on the market that utilize energy like radio frequency energy, which is basically electrical energy converted to heat, to try to tighten the skin. And I think what you'll see in the next couple of years is that type of thing going forward, because we do have people who are losing weight, but they have what we call lax skin. They don't want to take the big step of getting a tummy tuck. That's a big step, and there are surgeons in this town that do wonderful jobs, but there's no denying it's a big step for a patient. Is there something that can reduce the skin without going that surgical procedure route? And there's technologies being developed for that.
And that's separate from what we're talking about. That is an invasive procedure, correct?
It's not invasive. What we're talking about in terms of the heating, it's still delivered to the surface of the skin. And it's still actually very easy to do without any type of anesthesia.
But it's not as non-invasive as what we're looking at here.
It probably is, to be honest with you.
Is it?
Yeah, it probably is, because when you're trying to treat the fat through the skin, you've got to be very cognizant of not harming the skin, and it's kind of a hard thing to visualize. But if you want to take energy and you want to move it into the fat, which is 3 layers deep, and what you're telling the engineers are saying is if you heat up the surface of the skin too much, you're going to get a burn. And if you get a burn, it's a big complication.
Right.
So how can you heat the fat and not heat the surface of the skin? It's pretty amazing. So what the technologies are evolving to do is use a combination of heating and cooling. So there's cooling the surface of the skin on one hand, while on the other hand, the heating is being allowed to be driven deeper and deeper into the fat and the deeper part, and the skin itself, and heat that. So it's, there are hybrids that are being developed.
So that's more of the radio frequency.
More radio frequency and laser as well. Laser lipolysis or laser liposuction a couple years ago was all the rage. And that's because you can bypass the skin with the laser fiber in the middle of doing liposuction and deliver energy that way.
Excuse me, we have some more slides to share with you. Let's go to the next set if we can. This is slide number 11.
Yeah, this is another one of a female who doesn't look like the first couple patients. Again, she's defined, but she's not as well defined as we saw earlier. But her problem area, again, was the lower abdomen. Lower and to some degree upper abdomen. So that meaning below the belly button.
I mean, you can tell right there that bulge is not as present in
Correct.
the right-hand side, and that's after a full 3 months.
That's after a full 3 months. Now, you can argue, well, there's still a bit present, and again, we go back to the expectations of the patient.
Well, it's not going to be perfect, is it? Do people expect
No.
a perfect body as a
No.
result?
Interestingly, when you do some of these bigger procedures like liposuction, I've seen estimates of upwards of about 40 to 50% of the time they need to be redone because of irregularities caused by doing the procedure. So there's that aspect of it. You don't see that here with these procedures, but it's not going to be
When you say an
perfect.
irregularity, you mean like there's a deformed difference?
Meaning that it's a blind surgery. So when you're doing liposuction and you're taking a cannula, you're going underneath the skin and extracting fat, you really can't see
Right.
what you're doing. Plus, there's a lot of numbing in the field, and so areas are swollen. So you really have to do the best you can and then let things shake out over 3 to 6 months. Come back and see if you might have missed an area or if there was an area that was more dense than you suspected originally. And so touch-ups for liposuction are very common. So that's one thing. So, but with this procedure itself, one thing I can say is you do get a nice, even, gradual reduction. Is it enough to meet your expectations? Maybe, maybe not, and then you can repeat it. But that's one thing I like about this procedure.
Okay, I guess that's my follow-up. Do people really do expect to have that six-pack if a guy comes in or if a woman comes in and wants to have the perfect body to wear the bikini? Are they expecting that?
If they are, it's unrealistic.
Yeah.
So yeah, six-pack really is, that six-pack is so tough, but that definitely involves exercise on the part of the patient. And so if they're going to boost their exercise, if they're going to enhance their muscle mass and definition, and they're concurrently going to lose some weight, either through diet and exercise and through a procedure like Coolsculpting, I think they can expect to see, a difference visually. But if they're expecting to leave and have that be the result of a single treatment, this is where we spend a lot of time counseling patients on what to expect.
Because the difference is muscle versus fat.
Correct. That's correct.
Next slide, if we can. Now, you can tell a difference here, and this is a gentleman, correct? Or is this a woman?
So this is a gentleman. So, now you might ask yourself, are all these treatments, only for females? For women, the answer is absolutely not. We have a surprisingly high number of male patients. I would probably estimate in the 40%, 30 to 40% range who come in with a belly, and they want the belly treated, and they're generally in good shape. I mean, they may get to the gym a couple times a week, or conversely, they're so busy in their own lives they can't get to the gym or do what they want to do, and so they want to come in and eliminate this. And this is a good side profile view that shows you a decrease in the abdomen after one treatment.
All right. Now, so these pictures aren't doctored up or the pant isn't positioned in a different way. There is actually a difference here?
That's right. Yeah. One thing about body photography and actually facial photography is you have to have systems that are standardized. And so when the patient is standing, what you don't see is they're standing facing the exact same direction. Their feet are the exact same width apart. They're straight up and down in a position where every time you're getting the same reproducible photographic results. And that's hard to do. You have to have the right setup for it. And
I would think so. Now, so that's after 60 days, correct? Does that say 60 up there?
That's 60 days. So that's roughly two months. So, I mean, there is some variability.
Could he see a difference in the next 30 days?
Absolutely. Absolutely.
Interesting. All right, and then the next slide, is this the same patient from the back?
Different patient.
Okay.
And it's a male, so I picked another male to show you here. But this was a patient, again, who had, these are what the classic definition of love handles. And on the sides with some rolls. I mean, this patient is, you can tell they're in pretty good shape. I mean, they're
You really can. This person is probably lifting weights.
Right.
The arms seem to be bulked up. So you're telling me that that's also a definition of love handles when it's saggy like that in the back?
A little bit. There's a little bit of a roll. The love handle kind of extends circumferentially around the waist. And so you could argue this is, but you could say, well, part of this is back fat. So where do we make the distinction? It's probably a continuum. But the fact remains that with one treatment and the handpiece, the nice thing about the depending on the size of the handpiece, you can actually cover both areas if the person is narrow enough. So in this case, looking from the back, you can see an improvement in the side and on the back. Both.
You really can on the right-hand side.
That's right.
Because you can tell that that person does not have a big waist.
That's right.
Now, Dr. Munavalli has also sent us a piece of video. This is an animation, and it's short, but we do have it on a loop. So we'll want to make sure you understand exactly what we're seeing here, and he's going to give us a little play-by-play as we see it. So let's go ahead and roll it.
So this is an animation showing the fat cells. So we've gone through the skin into the fat, and what these are fat cells. The proper name adipocytes, we call them fat cells. And after they've been frozen, you can firstly see that not all of them have been frozen. Roughly speaking, a quarter of them. And why that is depends on the sensitivity of each individual cell and the proximity to muscle and so forth and blood flow. But they've been damaged. So over the course of that period of time, that fat layer I was talking about is being reduced. And it's being reduced at a proportion commensurate with the damage. And so you can see how that shows up on the patient is that roll slowly goes away.
Okay, so is it just nature that decides, okay, it's these cells that are going to be destroyed, and do these cells ever come back?
Yeah, there's been a lot of work recently about what's involved in the fat cell layer. We know there are fat cells. We know the body has two types of fat, white fat and brown fat. Typically, brown fat is found in the underarms and more in babies. This is all white fat. So even amongst fat cells, there are stem cells and other cell populations in there that may not be as susceptible to cold. So they're cells that are probably not going to take effect. But it all depends on. For example, if you look, as you see in this in the next, as the diagram starts to show the layer being reduced, I would expect that the fat cells that are furthest away from the muscle, because we're talking about layers here of skin, fat. You see that muscle layer at the bottom?
Yes.
What's in muscle is a lot of blood vessels. There's a lot of blood flowing through muscle. It needs it to survive.
Okay.
And with blood comes warmth. So you may be that you can't quite cool those cells to the point where they'll be damaged because of that constantly flowing blood near the muscle. So there's all these little local factors to take into play. But once you crystallize the fat, and this shows kind of the fat's being crystallized and those cells are damaged, and we showed that earlier with the histology, they're not going to recover.
Interesting. Okay, we have a follow-up tweet when it comes to talking about these fat cells. When you gain weight, do you produce new fat cells, or do your existing fat cells enlarge?
Yeah,
good question.
That's a very good question, and we touched on it earlier, is that you're really given the same number of fat cells. You're given the same number at birth, and they're going to be there. And so what happens over time is your fat cells just get bigger. And so we're reducing the number of fat cells, but the fat cells that are persisting, that are present, can still get bigger and smaller depending on your caloric intake and your total body weight.
Let's talk about the risks with this new procedure. What are the risks?
Well, the risks with any procedure involving the skin would be, are you going to damage the skin? And so back in the original we showed this apparatus going on, and there is a gel pad there. So there's good conductivity between the plate and the skin with the use of a pad that contains gel. So that protects the epidermis. So that all the heat all the cooling doesn't affect the skin, it just goes and affects the fat.
Jerry, if we could go back to slide 1 in case we have new viewers here in the second half of the show. So once this device is vacuum, it has a sucking sensation, a vacuum sensation.
Right.
If the patient feels, gosh, doc, I don't know, this doesn't feel real comfortable, is there's a way to adjust it, or is that sensation going to go away?
It takes time, and we try to hold patients' hands through that. We do stay in the room with them for the first couple minutes because it can be a little startling at first. It's like someone took two hands and started pulling a little bit on your roll. But you see here in the picture that there is a little thin membrane there between the skin and the it's a little pad, actually, and that contains gel. So that coupling gel, that prevents the surface of the skin from being damaged. So as long as you have that in place and it's intact, I don't worry so much about the surface of the skin. Now, what do we worry about? That's the question. Okay. And because you're cooling in the fat cell layer, there are blood vessels, there are nerves running through there, through all layers. And so some of these smaller cutaneous branches of nerves can be cooled as well, and they are. Okay. Now, are they damaged permanently? No, they're at a different level of susceptibility. But are they stunned, maybe, perhaps? Or the answer is yes. So, and I can speak from my experience. For a couple weeks after the procedure, I would run my fingers or my hands over top of the area that was treated, and it felt very tingly, very kind of prickly. Right. That sensation went away, but that is because of the effect on the cutaneous nerves.
because the nerves were stunned.
That's right.
And doctors will tell you, you confirm that the nerve is probably what? It takes a long time for a nerve to heal, correct?
Yeah, it takes some time for the conduction to return appropriately. Now, are we talking about big major nerves? No, there's no major nerves in these areas. These are all small cutaneous branches.
All right.
So some tingling, some numbness, some discomfort we've noticed in probably less than 10%. And have we ever had anybody where it's persisted beyond a couple weeks? The answer is no. Typically 3 weeks of maybe this to expect, if anything, and then patients go back to being just fine. So.
All right, so those are the risks that you are aware of. Have you heard of other risks from colleagues or other
I think when it's
surgeons
used
or
appropriately,
doctors doing this across the country?
No, it's a very safe, very, very safe if done properly. I mean, that's the thing that amazes me about these procedures. And one thing that when you go through a rigorous FDA approval process, I can tell you I've been to the FDA and I've talked to the FDA, and one thing they really hone in on is what is the incidence of X, Y, and Z complication in the study population. How did it occur? When did it resolve? How many sites did it occur in? They want to know. They really want to know. And so they're out to protect the public. So if you've gotten to this process where you have an FDA-approved device, all that's been analyzed. Can things still occur? Possibly. I mean, things can go wrong. These machines are always internally calibrated and so forth. But in the wrong hands with the wrong type of experience, it's possible.
All right, we just have about 7 minutes to go with this show. You're welcome to call the number on the screen or send me an email, jpop@wtvi.org. As always, we will send the emails and the questions that you call in during the week, even here at the station, to our visiting doctor on set this week, that is Dr. Munavalli. Now, you can also send me a tweet. That's instantaneously. You can send tweets as well after the show, and I'm taking them right now. We have a few more slides to share with you, so let's go to the next one if we can. What are we looking at here before and after?
So then the question remains, when someone comes in for a consultation, would they rather be a candidate for would they be a better candidate for liposuction? So I wanted to show you a couple pictures of someone who was better served having liposuction given their expectations and their body habitus. So this patient has, you can see, has some bulging around the stomach. Still, again, in very good shape speaking, but has some bulging around the stomach, the abdomen, and around the hips a little bit. So that's something she didn't like. Now, would she have been a good candidate for Coolsculpting? Probably around the hips, yes. But if you're treating that whole area, and this is where you have to get and feel, when we were feeling the areas to treat, we noticed there's a certain amount of fat it was a little bit more fibrous and dense, and there's a certain amount of fat that was actually in the abdomen where nothing can get to it. So we wanted her to get the improvement she was looking for was more than just, say, a small reduction. She wanted a big difference. She wanted, and this is where the candidate was perfect for liposuction. And these are the before pictures showing dead in front and center and then in the profile.
All right. And then is the next set of pictures?
The next set of pictures will kind of show you what was the result of that. And so this is what you can get with liposuction. So first thing to realize is the before picture on the left, the after on the right. Okay, and this is a profile view. And if you look closely on the right, you can see there's two small pink little areas where we had to use the cannulas to go in. So there is some evidence there, and those will completely go away.
They will.
But even in a couple months, you can see some small evidence that we were there.
Is this still considered non-invasive?
Now, liposuction, it depends on how you do it. The invasiveness is determined by two things in my mind, about what instruments you use and then what setting it's done in. And that's where liposuction becomes, so sometimes patients will get liposuction in an operating room in a hospital under general anesthesia. That's one way of doing it. Another way that's evolved over the past, say, 10 years, 15 years, is to do it more in an outpatient setting using tumescent or local anesthesia in a dilute volume, which is what we did here. Okay. So that patient is not out, they're not on a ventilator, they're not out of commission. They have some oral sedation or IM sedation, but they're talking to you, they're awake. If you need to have them roll over, they can help you. That takes almost all the risk out of doing these procedures. And so, from my mind, you can still do liposuction in a minimally invasive fashion, doing it this way.
Interesting. We are taking some phone calls, and I understand a lot of these calls, they want to talk about the cost. Is this procedure, this Coolsculpting, is it covered by insurance?
No, it's totally a cosmetic procedure. Unlike what you saw in bariatric surgery a couple weeks ago, where it can really affect someone's quality of life, you can imagine these patients are doing just fine. And they might be bothered by the look from a cosmetic standpoint, but it's not affecting their health. So the answer is no.
All right. So It's not a form of liposuction that we just explained there, showing the difference.
That's right.
But with the short history that we have with this new procedure, of course, it hasn't been around as long as liposuction.
Right.
Do you still feel as comfortable long term?
Yeah, with 2 years experience is more than enough. When you report things in the literature, in the scientific literature, and looking at, well, what happens to these patients? Now, at least in our practice, we've had several years to evaluate them and follow up and see how they've been doing. And that gives you a really good estimation of what's going to be projected going forward. And so I feel very confident. And I'm not the only one. There have been people doing this procedure for 3 or 4 years. And in terms of review of the literature, which I did recently to look for complications, there really are none reported. Now, if people go back to changing their lifestyle, become more sedentary, start to eat more and exercise less, will they put on weight? Absolutely. Will it go? Where will it go? Well, remember, if you're moving 25% of the layer, you still got 75% there. So that 75% can still expand. Whereas with liposuction, if you remove 70 or 80%, you've only got 20% that can expand. So it could seemingly come back in the same areas where you treat it with Coolsculpting, or it could go elsewhere.
All right. We normally don't talk about cost here on Healthwise, but like we've had other doctors who have expressed that, hey, look, these people who decide to elect these procedures, this is an investment for them. Is that how you look at it?
Absolutely. I mean, they're investing in themselves and their self-confidence and, and their appearance. And so it's an investment. And so first and foremost, we want to make sure it's safe. We want to make sure it works. I mean, we want to have it affordable, obviously. A non-invasive procedure allows you to make it more affordable because there's no cost for anesthesia. There's no cost for a lot of the things you would need for liposuction, a lot of supplies and so forth, and the time factor as well, because the procedure is being done in a room with the patient in the machine. The patient is watched for the first 10 minutes, but then they're on their own. They're reading a book, they have a pager, they can contact us whenever they need to. So the end result of that is the procedure can be fairly inexpensive compared to a liposuction procedure.
Okay, you're also part of the staff at Wake Forest, correct?
I am. I've been fortunate enough to be training and working with the dermatology department at Wake Forest and Johns Hopkins before that. So.
Do you actually help spread the word about this procedure? Do you teach?
Well, when the residents come to see us, and again, the department is, they're really a world-class department, and what we can add to the department is some of these devices that they don't get a chance to see in their normal training. When they can come and view these procedures being done and look at these things and learn a little bit about it from a scientific point of view instead of kind of the marketing point of view. So it's exciting to expose a whole new generation of dermatologists to these newer devices, and that's where I feel they have an advantage.
Dr. Munavalli, you grew up in Salisbury, correct?
I did. I was just there yesterday in town, so I really enjoy it.
All right. And what made you decide to keep your practice here in the Charlotte area as opposed to other places? Because you have practiced in other parts of the country, correct?
We've been all around. My wife and I have been everywhere from California to Maryland to Atlanta to here. And, I grew up here. This is home for me. My parents are now relocated very close by. They immigrated from overseas in the 60s, and they just love this place. And so we're happy. And 6 years ago, we joined an established practice that had been here for 20 years. And it speaks volumes about the practice before we got there and about the people in the city now.
Thank you so much for reappearing.
Thank you.
Yes, he had been on the show a few years ago, and you need to come back with more technology.
Thank you very much.
We thank Dr. Gilly Munavalli of Dermatology Laser and Vein Specialists of the Carolinas right here in Charlotte. We hope that this medical broadcast has helped you become more health-wise. Keep in mind, you're welcome to send me a question if you did not get it in this hour. I will pass it along to Dr. Munavalli, and you will be hearing back the result. As always,